Okay. Okay ang sound?
Okay po, Doc.
Okay, so here we go. Let's go to drug testing. Now, screening for drugs of abuse. In overseas, they do screening of drug abuse, especially during emergency situations inside the emergency departments, hospitals. Yeah. When you consult a doctor, they need to know if you are taking any medication or misusing the medication or using an illegal drug. And for employment screening, usually urine, and if urine testing is on a borderline, they will do blood levels of most common illegal drugs and forensic testing. If you are caught, say, speeding on a highway and the blood alcohol breath when you were stopped by police on the highway is positive, they will arrest you and bring you to the hospital for in emergency room, and they will get some blood levels of your blood to confirm for the high positive alcohol breath, which was done initially by screening on the highway. So the keywords are emergency testing or STAT. STAT means immediately, point of care testing, employment screening, forensic testing. Okay. Now, sometimes those persons who are required to do regular body screening for illegal drugs are those who were convicted in and in prison and they were on parole. So they have to report to the department agency where the parole parole procedures for you is to stay outside the prison if you are complying with the agreement that you will not do anymore illegal drugs. Okay, so sometimes they do cheat the system. Nandadaya sila. The government, I do not know if this is done sa atin sa Manila. But if you do urine drug testing sa Manila, libo yata ang bayad. Okay. Overseas, it is done urine drug testing regularly every month so that you will stay outside the prison. You must submit clean urine. Clean urine means it does not show any level of any illegal drugs on your urine, especially methamphetamine, shabu-shabu. However, um, they cheat, they make daya. So if they collect urine at the testing center, uh, they bring a small bottle similar to the appearance of a urine, and when they collect urine in the toilet, they will give you a urine similar, a liquid similar to the appearance of a urine. However, the urine drug testing kit uh, that uh, that are used in those system detects the temperature of the liquid that you submit for urine drug testing. So if the temperature of the urine that you submitted is not like that of the body temperature, that means that you are submitting is not urine at all. Okay? So sometimes they submit a liquid or a fluid, but after testing in the laboratory shows that the pH is less than on the normal value of a urine. They can easily detect that. So from your year level 10, 11, 12, you will know from your chemistry that the pH, if it's 4.5 is acidic, and higher than 4.5 to 7 and over is alkaline. Okay, so the urine usually is have acidic reaction to litmus paper with which is blue to red. When you put a litmus paper on the fluid, if it's acidic, it will turn to red from blue. Okay. Hey. Sometimes they submit a urine liquid, a urine, but they add something to so that the blood testing in the forensic laboratory will not detect the presence of the illegal drugs. Okay. Yeah. So so, so that the urine they submitted may not be their own. They may get it someone who has not taken um, any illegal drug, and they bring that into the toilet where they put in the collecting bottle a urine that is not theirs. But the system in the parole board, they will have an inbuilt CCTV camera inside the toilet, and they will be able to see how you collect urine. Okay. And remember, those who collect urine regularly for illegal drugs were convicted. So by the time that they have collected urine, you cannot just say you collected a urine of somebody else, or you have submitted a fluid that is not urine, or you have added something on your urine so that the legal drugs will not be able to be detected. Remember that they are still not off the hook on drug addiction, especially shabu-shabu. Sometimes they will make trouble when you say that you were not doing the right thing. So from there, you can have trouble with them. So the best thing to do is not to say anything, and the laboratory will just report to the police or the parole board that he submitted a uh, a fluid that is not a urine, or submitted a specimen that with some additives or other chemicals, so that the chemical tests will not be able to detect the illegal drugs. Okay. Now, this is what we were talking before. Why you screen for urine for emergency testing with a stat immediately, point of care in a doctor's clinic, employment screening if you would like to apply for a job, especially you are driving a train or driving a bus, because you should have no level of any illegal drugs on your system, or forensic testing. Okay, just like we said, the parole board need to have your urine submitted regularly. Okay. So specimen validity testing. Okay. Okay. So as we said before, the specimen that is submitted to yourself may be altered. So there was a form of manipulation. So the term there is pre-analytic phase manipulation. That is before the specimen is subjected to forensic testing in a forensic science laboratory. And we have discussed so far are the patient tricks. They collect urine that is not similar, a fluid not similar to urine. And they use a substance to mask the presence of an illegal drug in their urine, so that it will give a false positive or false negative result. And one of them is adulteration or substitution. So we have said that the pH is not within, the urine pH is not within 3 or 11. Um, it is not urine that they are submitting, as we discussed the necessity of submission of urine for forensic examination. Okay. Next. So the following agents or substance are the tricks that the person may submit, so that the presence of an illegal drug in the urine would not be detected properly. Okay. Okay. So there is an adulteration and addition of substance that interferes with the screening tests, causing the procedure not to detect the presence of illegal drug, and the specimen validity testing is altered, and the pH of the sample and the specimen will be reported as substituted when at least one of the following criteria is met. So if there is a form of substitution, the criteria of the following should be met. Okay. So urine, should be at the level of 4.5 to 7.8. If it's on this level, there may be something additive there or foreign substance in the urine that will make the testing not reliable or um, makes the detection of the specimen in the urine very weak. So nitrites, chromium, halogen, glutaraldehyde. So nitrites, the most common are the bacon substance, salami, deli food, yung mga sausages, ano pa bang mga ano yan. Because nitrite is used to preserve this delicacy or deli food, yung mga sausages, salami, and bacon. Okay. Chromium, those chemicals that present up in the household like paints, dyes, curing agents, okay? Chemical halogen is present in the bleach. So they may put some bleach on the small container, and while they collect it, they will add bleach, ordinary Clorox at home. Iodine, fluoride, is a Colgate, glutaraldehyde, yung mga sa fabric softeners, the ones you use when you do um, a what do you call that washing machine. You put a fabric softener so that when the clothes are dry, they will be soft. Fixatives, antiperspirants, so yung mga nilalagay sa body to prevent any perspiration, and smelly armpits kagaya ng Beetle o mga kung anong available dyan na mabibili sa Mercury, sa drug chain stores kagaya ng Nivea. Okay. And one of them is pyridine. Pyridine. So pyridine is present in sa mga paints, pesticides, adhesives, yung ano ba yung sinisinghot ng mga bata sa kalye, yung glue. Para mahay sila. Sometimes they are being added to the substance to be examined in the forensic laboratory. Okay. Now, there is a variability among clinical collection sites with regard to adherence to ascertaining whether strict collection protocols are part of a standard operating procedure and enforced. So, sa Philippines, iba-iba ang mga protocol for collecting urine drug sample. Overseas, ganun din. Okay? So, overall, the chain of custody is important when you receive the specimen for forensic testing. The chain of custody is observed. So you sign on the bottle of the specimen. You sign on a paperwork when you submitted to the laboratory, the collecting personnel will receive all those things and they will issue you a copy, the date and time, so the chain of custody protocols. Okay? Yan. So summary, we have discussed the part one of poisoning. And if you are still there, we will do part two of the poisoning. Are you still there? Hello? Hello?